Interprofessional collaboration from a physical therapy standpoint at its very basic is two or more professionals coming together to develop and accomplish goals that are patient-centered and that will meet the unique needs of our patients.
I can narrow it down to two things. One is continuing education. And it is really important that once you become a rec therapist and you have your setting that you are working in or your clientele, that you are continuing to interact with the profession in different professional organizations, and you are continuing to develop and refine your skill set. And then the second thing is your ability to interact and work with your colleagues, and so that could be your treatment team, could be the physicians, the nurses, the social worker, physical therapist, occupational therapist, anyone that is working with those clients. So you're working collaboratively, and it also helps you increase your knowledge and be a better professional.
Well, fundamentally, I'm a sports sociologist, and so I do a lot of interprofessional, interdisciplinary work with people in lots of different disciplines: anthropology, sociology, philosophy, psychology, and so my training and upbringing actually has a lot of interprofessional collaborations housed within it.
As dietitians, we work to identify and assess a patient's or even a community's healthcare needs, and then once those needs are identified, we educate and communicate other healthcare, allied healthcare professions, or other people who can help assist achieve the best quality care for that individual or patient.
So I see the value in interprofessional collaboration because you don't know what you don't know. And when you bring someone in who has a skill set or a particular expertise in an area, they can fill in areas of your own research or your own practice that you didn't even know was missing.
I think the value is really for the client. Because if you are in your silo and you're only, if I'm only worried about rec therapy, then I am not able to serve the client to the best of my ability. So if I'm able to understand the perspective of the social worker, the physician, the OT, the PT, what angle they're taking, what they're specifically focusing on, then I can bring that into the work that I'm doing, and it just serves the client better.
A general focus on what's best for the client. If we're not communicating and we're not practicing good interprofessional collaboration, we're all approaching the client from different perspectives, and that may not be the best use of our time or the patient's effort. So we want to make sure that we focus on what's important for the client, and we all together are able to integrate our integrations and our approaches so that the client's goals are met.
So the value really is reaching out, being humble, and allowing folks to speak into your work and allowing yourself to speak into their work.
Baylor graduates need to be able to have the skills to practice collaboratively so that they can actually be able to advance the work that they're seeking to do, being able to serve the individuals and communities that they are going to be working with in a way that will actually produce favorable outcomes. So being able to have these skills will equip Baylor graduates to be able to know what to do, how to do it, who to pull around the table, so that different interventions or practices that are underway can be able to achieve the outcome that's desired.
So I think at Baylor it's important that we educate our students about interdisciplinary care, because we are striving to mold our students and to push them to be worldwide leaders and to serve others. And we can't do that unless we communicate with other people in their specialties, because it's impossible to be an expert on everything. And when you work and you communicate with other experts, you learn so much more, and you can serve and reach goals that you never really thought that you would.
The Baylor brand, particularly as an R1 research institution, is highly respected in the community. And so we really need to provide our graduates with the highest, most innovative quality of education and practice so that they can best represent that Baylor brand out in the settings where they work.
Everything we do really does not occur in silos, and we sometimes get to this place where we're trying to practice in silos, and by really encouraging interprofessional education at Baylor, we're able to teach our students how important it is to have that collaboration It also really helps to reduce those prejudices or kind of rivalries that may occur when we do practice in silos. So ensuring that IPE is something that is a forefront piece of what we teach all of our Baylor graduates helps us to have an understanding of one another's professions and how we can truly aid our clients in reaching their best potential.
So Baylor graduates need to have the skills to practice into collaborative because we are the face of Baylor. We're very proud of the programs that we produce the graduates from at Baylor, and we feel like we're going to go out and represent the very best in interprofessional collaboration. So knowing those skills, knowing those professional behaviors that will let our graduates shine in that interprofessional environment is what our goal is.
I think there are some settings that are highly collaborative, inpatient rehab, some skilled nursing facilities, because the team is present physically together, they meet routinely, whereas other settings are much more difficult, such as a home health setting where practitioners are practicing very independently. So the environment itself can be a barrier. I also think technology can be a barrier or a facilitator, as we're often using multiple electronic medical records and they don't necessarily communicate. So I think for me, environmental and technology are some of the biggest barriers.
If the students are not prepared to do it in their education, they've not experienced it, so it's not within their skill set or not even on their radar. And then a second thing would be if they're not confident and they don't feel like they're a valued member of the team, they feel like they need to kind of stay in their own silo. So it needs to be almost second nature, and part of that is going to come from it being integrated into undergraduate education, all levels of education, so it's just expected, and they're contributing to it and almost initiating it if need be.
Potentially a lack of preparation for interprofessional collaboration. And so when that happens across professions, then there's somewhat of this lack of interest or desire to look for opportunities to collaborate. And so that definitely can serve as a barrier when you're trying to be able to pull people to the table. I think another barrier has to do with some of the resources or supports that are in place or not in place that can really foster support for working collaboratively. So I think some of those barriers are changing, which is good, but the way in which our students at Baylor are being prepared to think about interprofessional collaboration from the outset is really going to be valuable to drive that movement forward so that we can be more effective in practice.